The next issue I want to talk about in the series on borderline personality disorder based on my book is stay in therapy even if it's dull. Therapy can assist the borderline in myriad ways with short-term and long-term positive effects, which are often beneficial. Because the borderline develops during adulthood, he needs someone who understands clinically how change affects him and thus help guide him when he comes to a fork in the road. Obviously, it's important to find the right therapist and with the right modality so that the borderline can establish a sense of trust or therapeutic alliance and realistic goals. Therapeutic goals are not always hugely important, as the focus of therapy is the therapeutic alliance itself and the corrective emotional experience which occurs. People benefit from therapy in different ways over a period of months or years, and many people, including borderlines, benefit in ways that they do not even realize. Therapy may seem dull because several core issues are talked about repeatedly, sometimes making therapy seem ineffective. However, it is the very return to core issues, thinking and rethinking them from different emotional vantage points, that may be most helpful for the borderline. Although progress may be linear, staying in therapy is crucial regardless of whether the borderline believes it helps, because therapy is a professional holding environment where a clinical expert can provide support and feedback in ways that are simply impossible in any other context or relationship. It's not unusual for borderlines to feel that they are ignored, misunderstood, or even ridiculed by others. As such, it is not unusual for the borderline to go from therapist to therapist, disappointed that he has not found someone who understands him. Obviously, the borderline needs to be with a therapist he feels comfortable with so that a therapeutic alliance of trust is possible. However, the therapist is not a friend, but a clinical service provider. There is something beneficial about giving a therapist, or any professional, the benefit of the doubt, just like you give your doctor the benefit of the doubt, even given the huge number of medical errors that occur. Regular visits to a psychiatrist for medication may or may not be helpful, but these visits occur only every few months and amount to little more than saying hello and getting a new prescription. Weirdly, in the United States, the majority of psychiatric medication is prescribed by non-psychiatrists, such as primary care physicians who have minimal expertise in clinical mental health. In 1954, antipsychotic medications emerged, permitting some persons afflicted with schizophrenia to experience an almost miraculous decrease in hallucinations, delusions, and even negative symptoms. In turn, psychiatrists came to assume that medications could cure all psychiatric illness, or at least decrease symptoms to a remarkable degree. However, psychiatry has taken this to an extreme, and with the massive influence of Big Pharma, the large majority of psychiatrists only prescribe medication, and the vast majority of psychotherapy is conducted by non-psychiatrists. Medications can be extremely helpful for a wide variety of reasons, but talk therapy is priceless beyond jewels. The borderline should also stay in therapy for his present or future partner. The borderline may find himself content now, but in a few months or years, he will find himself in a relationship. Even if that relationship is healthy and safe, the borderline may inexplicitly find himself at times acutely angry, frustrated, or even lashing out at his partner for whom he feels genuine love. Thus, therapy not only attends to past injuries and present situations, but it also helps with issues that will emerge in future relationships in unanticipated ways. The borderline must plan with both short-term and long-term strategies to live in a meaningful, content life for himself and his loved ones. While there is a saturation of psychotherapists in places such as New York and Los Angeles, there is a drought of mental health professionals in many other parts of the United States. For many people, psychiatric care is anathema to their cultural background, and mental health diagnoses are stigmatized. For the borderline who grew up in such a place, it may be hard to connect with a therapist, but the effort must be made. In therapy, thoughts and feelings are processed to understand where they come from, how they affect us, and how we can live our lives in a more constructive manner. In reality, however, Some thoughts and feelings are best left in the basement or attic. We live in an apartment, so I don't know from either. Some thoughts and feelings must be left alone because contending with these thoughts and feelings will not necessarily be helpful or yield positive psychological growth, especially for high-functioning people. My father was once referred a patient for consultation because the physician thought that the patient could benefit from therapy. My father assessed the patient and wrote back to the physician, "Leave well enough alone." Sometimes no therapy is a better option, especially if the person benefits from other sources of support and insight, such as an executive functioning helper.